Dear colleagues, Assalamu alaikum. I am Professor Dr. Niaz from Hebron Medical University. I hope you will be fine. Today I want to share with you some advancement and improvements that we plan for uplifting of the poor healthcare system of the government of Khyber Pakhtunkhwa through the involvement of World Health Organization through a series of workshops and of course my position while working as professor of pharmacology and related to health disciplines. So I am thankful to the then Vice Chancellor, Professor Dr. Hafizullah, and Director OREC, the then Director OREC, Ziaul Haq, Dr. Ziaul Haq, who compiled this document and asked us. I'm also thankful to the whole management of the healthcare system of the government of Khyber Pakhtunkhwa Health Department, and of course my other colleagues who supported me, like what you can say, some senior colleagues, to get this data and plan some strategic planning. Why there is a need for this document? There is a need for this document because we want to bring improvement in the poor healthcare system. Let me proceed. And while proceeding, it is important to remember some point. While reading this document, please Google these words: self-belief, self-esteem, self-regulation, and of course the Lord Macaulay's speech, that how he planned to affect our whole education system. For me, Lord Macaulay's speech is not the yardstick, but it is important that let our youth should know that how our old ancient education system was affected, adversely affected rather, and we went down. This is just a touch with that, though it is related or indirectly related with this. Now let me proceed to the point, because these points will open your eyes and then you will own this particular strategic framework to uplift this education, the healthcare system. Some information about the document, that is, as I already told, but this document we call it as Human Resources for Health, HRH, Strategic Framework. You see, Strategic Framework of the government of Khyber Pakhtunkhwa. This document was finalized, in fact, in the year 2016, and the history is that we started work on this probably in the year 2015. When the KP government was trying to bring changes in the healthcare system, so then they consulted WHO, and the WHO told them that first you should perform your SWOT analysis, and you should know that where do you stand, mean where the provincial government stand, and then we can design, devise policies and strategic planning to bring a change in the healthcare system. So this was a brief history, and this is properly acknowledged in this acknowledgement section. You can see this through the government of Khyber Pakhtunkhwa, and of course the support was available input from the stakeholder involved. The consultative meeting contributed directly to develop these frameworks for the existing shape, and valuable input starts and time to time that we work together. The technical support, facilitation, and guidance was provided to the WHO, World Health Organization, in the settled up in Islamabad, but it carries to a series of workshops held at Pearl Continental Hotel, Peshawar. Point to remember is that this was undertaken under the due approval of the Department of Health of the then government of KP. So this is a technical point. It's not merely a document that technical document somebody prepared. It is, you can say now, an official documents. And official documents can now be followed by any person under the rights of the Constitution of the Islamic Republic of Pakistan for its implementation. This is a very technical point that you should keep in mind. Now, having said that, this is something related to the introduction, and you can read this, but I'm not more concerned with that because I want to share with you some more focal points, as the complete document is available on request and I can email you. So, if you go on to the detail, education, institution and staff regarding the health. So in every what you can say discipline, there were 8 medical college and 9 private medical college teaching staff, or 888 for the producing the doctors of the province, where 4 public and 5 private dental colleges were there, and there are 8 public and 4 private institutes offering pharmacy education, produce 680 graduates in pharmacy per year. This is a very technical point. And once we were asking for the implementation of the drug rules which were amended, so I came to know that somebody misguided the certain governments of the different provinces, and they said that there is dearth, unavailability of the skilled human resource, so that we cannot implement that. So I have to tell you, this is an eye-opening slide, that these much graduates are produced in a year in Pakistan in pharmacy institute. So there is no dearth, rather we are producing quality graduates for the country abroad, the Gulf and international level. So this is a slide of the government of KPUC, and I got that there are 2,650 medical doctors with a population per thousand ratio like this one, where the pharmacist ratio is very poor, that is 0.0039, and it was they were merely 62. Though after the owning of this document in the year 2016, some more posts were advertised, but nevertheless it's still not double yet, if I'm not wrong. So nurses and paramedics and other staff, there's a 26,000 plus minus, and this is the true story. Now going to the next slide. Once we perform the SWOT analysis, so we find that skilled workers potential, movement in the right direction, and HRH policy, directors and technical assistant, availability of training institutes. So we focus on these points, but the weaknesses were migration of the doctors and the pharmacy doctor, the pharmacists, nurses and other allied health profession, that they migrate from the country. We agreed on this point. More, this maldistribution of health workforce and less number of public and government funded posts, and then that they are not filled in totality, you see. And it was based on this report that the provincial government filled all the position of the medical doctors, but we are still looking for per thousand population ratio, as the WHO recommended. The allied health professions, the pharmacy health profession and the physiotherapy health profession, the nurses profession should be, the post should be increased, and it should be as per the per thousand population as set by the WHO. Now having said that, other weak point was that salary incentives and wages are not competitive and unsatisfactory. This is a point where a man never becomes satisfied, so I will ignore for in the better interest of the people of Islamic Republic of Pakistan. So another point, valid point, was poor health HRH management. So management is very weak. Imbalance in skill mix, that is doctor, pharmacists, nurses and other health. There is an imbalance between this, and once if there is an imbalance, so your healthcare system will be limping, and one limping healthcare system cannot deliver. So you know this, and we are agreed on this point. But interesting point is that poor linkages in the health and the education department, like pharmacy education is not with health, though its services are with the health department. This is the dilemma in Pakistan, that pharmacy education is not with the health, though its services are with health. Astonishing. No practices of clinical pharmacy in the hospital. Do we need this? We want practices of clinical pharmacy like that of technologically advanced countries, UK and USA and France, where the pharmacist write with the green ink, and he, along with physician, is a good partner of the healthcare system, where the induction of pharmacists has minimized the incidence of adverse drug reaction, and they have significantly reduced the mortality, morbidity, and of course the economic burden through the induction of clinical pharmacists. So this will be our demand from the government, that please, once it is identified in the SWOT analysis that there are no practices of clinical pharmacy, so please, we should look into the matter deliberately, and we should start the practice of clinical pharmacy. The other point was weak in service training. Yes, this is important. In the Provincial Health Services Academy, usually physicians and dentists are asked when they are going for training, but there is no such training for the drug inspector newly appointed. There is no such training settled for the pharmacists newly appointed, though they are gazetted officers. So this is a point that the allied health profession and the pharmacy, they should be trained as per the requirement of the society, either through the Provincial Health Services Academy or the quarter concerned. And the next point was no proper policy, existence of no proper policy for as insurance of the health worker and the process of claiming a pension. So you see, this was the overall SWOT analysis of our healthcare system. So these represents the weaknesses, and once you determine your weaknesses, then our problem, then to every problem there is solution. So let me move on to next slide, and probably pre-service training is at the entry level, no standardized entry level at the medical colleges and the allied health professions. So this is important. And the policies of regulatory bodies like Pakistan Medical and Dental Council, Pakistan Nursing Council, Pakistan Pharmacy Council, and other medical faculty, they should be properly implemented. And there is no liaison because one regulatory council is predominating the other. So this is a dilemma as well. Now going forward rather. So we planned certain objectives and strategies based on these weaknesses, and I will start our carry to this may be a point of concern for the leadership and the governance, and of course we need that. But I will carry you to a next slide, and the next slide, that is, you see, again a continuity of that and rationale that academic quality standard indicator established implementation board in the public and private sector should be there, and this should be in the curriculum, it should be in the academic faculty and the stopping, and of course the quality graduates subsequently. This is the rationale and this is the strategy. You can read this. Academic quality and standard indicated, established and implemented in both the public and private sector, as I said. So concerned regulatory bodies like PMDC, Pakistan Nursing Council, Pharmacy Council of Pakistan, etc., there should be a liaison between them, and it should be, for example, if curricular reforms are there, it should be as per the need of the society, and that should be as per the need of the society of the Islamic Republic of Pakistan, not for other technologically advanced countries, because we are producing our health graduates, health professionals for our own society. So this is a technical point, and in the outcome number 2, we have to ensure quality and quantity of the workforce with respect to gender, skill mix, urban, rural, equitably distribution throughout effective, transparent and robust recruitment mechanism. Now keeping in view this point, so if we have to focus on this output, that recruitment needs identified and educated for increase in number of posts in all medical and associated health professions, particularly in disciplines like pharmacy, physiotherapy, epidemiology and other health profession and allied health profession. So this was the rationale, since the number of posts currently are not as per the requirement of the population as described above, as I told in the previous slide. So situation is very critical, and therefore this was the rationale and we recommended. So what is the strategy? The strategy framework is that health professional assessment conducted to identify the gaps in HRH in each district and sub-district level against the standard requirement of health professionals per thousand population as settled by the WHO or the national standards. Now, the present findings and the recommendation of the HRH need assessment, and professional government should educate for the increase in the number of posts. So we ask for the increase in number of posts in the medical, in the pharmacy, in the nursing, physiotherapy, and of course allied health professional. But this is very technical point to remember, that pharmacy education should be with health department. Remember, we in the SWOT analysis determined that pharmacy education is not with health. So here it is recommended in the strategic framework to the government of KP that pharmacy education should be with health department as per practice in international standards. The provincial government should start clinical pharmacy services in teaching hospital. Furthermore, the proposal for the establishment of clinical pharmacy practices as per practice in technologically advanced countries like UK, USA. And a very technical point is that KMU should come with its own college of pharmacy as role model for this purpose. We are trying this, but this is the rationale, that no clinical pharmacy practices and pharmaceutical unit are there in the hospital. We are just dispensing drugs and they are just like storekeepers. So if we want to improve the healthcare system, therefore we should bring a role model college of pharmacy, where should be like, just like we have a college of physician and surgeon in Pakistan and their upper residency program, in orthopedic, medicine, dentistry, etc. blah blah. So likely there is American College of Clinical Pharmacy which regulate residency programs in different disciplines of pharmacy, clinical pharmacy, and that is, for example, internal medicine pharmacy, oncological pharmacy, and pediatric pharmacy. And this will be just like that of the American College of Clinical Pharmacy, the postgraduate year 1, year 2, year 3, and year 4 program. And only then we can deliver. So there is a loop where pharmacy education is not with health, so we have poor education system. Second is there should be a curricular reform, and once we made a curricular reform like that of UK and USA, so then we will deliver, because a very good curriculum can efficiently deliver and there will be an improvement in the healthcare system. So our point of concern is curricular reform. In this regard, I have requested the Chief Justice of the Islamic Republic of Pakistan, and of course with a copy to the Chairman Higher Education Commission of Islamabad, that curriculum reforms, curriculum changes should be as per the technologically advanced countries. Unfortunately, if we perform blueprinting of the curriculum of the Pakistan pharmacy current, that 2013, there is not a single word of competency. Astonishing. There are not so much standard mentioned. Only objectives are there, and they are written as it should be like that. It's just like that somebody asked, requested through either a group of students, and they are just entered in. So curricular reform should be through the curricular expert and stakeholder to bring change in the healthcare system and the pharmacy practices in Pakistan as per technologically advanced country. These were the budget. Of course, we were not consulted for the budgets, but still something is there on the board, and we request all of you that please go through this document. The complete document is available on request. I would say at the end with the Lam Iqbal share, that is अफराद के हाथों में है अक़वाम की तकदीर, हर फ़र्द है मिल्लत के मुक़द्दर का सितारा. ये नहीं है कि बस. और what is the dilemma of Pakistan healthcare system, that one of the discipline is very much predominant, and it lives at the cost of other like dentistry, pharmacy, and weak discipline are dentistry, nursing, and ignored discipline are pharmacy and paramedics. So you see, I request the healthcare, the Secretary Health, all of you, to please go through this document, and once you ask for your right within the norms and values of the Constitution of the Islamic Republic of Pakistan and your institution wherever you are serving. And this is a document which is a legal document which has been owned by the government of KP, prepared on the request of the then government of KP, and we should ask for its implementation through in shape of what you can say establishing of the clinical pharmacy practices in Pakistan. Now here I have come to know that some of the education universities, since universities are offering pharmacy education, so some of teachers are concerned that they are resident in their university houses. So this is illogical. I would request all of you, it can be on the analogy of Heber Medical College, where the teachers are residing in the professor colony of the University of Peshawar, but they are on the payroll of the health department, and they are living in the Peshawar University. Nobody proposed them to leave the houses. So I would request all of the teachers sitting in the university, let the education should be improved through a curricular reform, through the Higher Education Commission. The education should come with within the vision of the health department of the KP, and it should be what you can say, so then we can deliver. And of course the university should regulate the business through taking its conduct of exam as we conduct the exam of other affiliated medical colleges and dental colleges. So nothing happened wrong, rather the system is improving, and it can be on the analogy of this system as well. With this, thank you very much, and thank you for watching this video. I hope I have not hurted somebody else. If hurted, I regret for that, but this is important, as these documents were compiled by us with the hope that there will be a change in the healthcare system. Thank you very much.